Hi, are you having osteoarthritis of the knees? Then you need to be careful during this monsoon season. But not to worry, I will tell you how to cope up with the monsoon and osteoarthritis of the knees. Hi, I am Dr. Pradeep Kr Shenoy, India's first DNB consultant rheumatologist, addressing you from Amrita Center for Rheumatic Diseases in Bangalore. Osteoarthritis is a very common condition among general population. Knee is the largest joint in the human body. It is consisted of three bones, that is femur, patella, and the tibia. Subsequently, it has got three compartments, that is medial and lateral tibiofemoral compartments and patellofemoral compartment. And the structure within the joint is articular cartilage and the menisci. The articular cartilage on the femur is on the top of the menisci, and the articular cartilage on the tibia is below the menisci. And osteoarthritis is nothing but degeneration of the articular cartilage and thinning of the menisci. And this alters the alignment of the joint line. Then cells secrete inflammatory mediators and growth factors into the joint cavity, and these mediators stimulate the mesenchymal lining of the bone, that is the periosteum, to differentiate into osteoblasts. Osteoblasts lay down cartilage matrix, and ultimately this cartilage matrix gets calcified and forms a bone tissue. These are called as osteophytes. Osteophytes are nothing but body's desperate attempt to maintain the alignment of the knee joint. These osteophytes can produce problems during rapid movement of the knee joint. They can chip out and get lodged into the knee joint space, knee joint cavity. Along with it, degenerated cartilage substances also can be dislodged into the joint cavities, and they can be stuck in between the moving part of the joint, and this can produce locking of the knee joint. And in mild cases, we usually advise rest and topical application of the gel and hot baths. This will usually dislodge the loose bodies, but in case if the loose bodies are large, then the patient requires arthroscopy. Ordinary course of nature, if the loose bodies are small, patients will recover with 2 to 3 weeks of rest and NSAID gel application and hot baths. So this is a complication that is produced by the osteophytes as well as cartilage degradation products. The sensation from the knees are carried to the brain by proprioceptors or mechanoceptors, which are situated in the ligaments, fibrous layer of the capsule, and the periosteum. They carry the joint position sense via the posterior column to the cerebellum, from the cerebellum to thalamus, and thalamus to the parietal cortex. And if there is any problem with the joint position sensation, then the mechanoceptors send the altered signals to the brain, and brain shuts off the quadriceps muscles. Then voluntary use of quadriceps muscles comes down. Coming to the muscles in and around the knee joint is maintained by two muscles. The alignment of the knee joint is mainly maintained by two muscles, that is quadriceps anteriorly and posteriorly hamstrings. When the quadriceps go into atrophy, the hamstrings can undergo muscle spasm. This can worsen the alignment of the knee joint. Now, there is one condition called arthritogenic muscle inhibition. Whenever there is altered joint axis, the mechanoceptors or the proprioceptors send altered signal to the brain, and the brain shuts down the quadriceps. That is, the brain shuts down the voluntary movement of the quadriceps. Along with it, when there is diffuse atrophy of the quadriceps, quadriceps undergoes severe wasting and hamstrings undergo severe spasm. That is why during treatment we adopt quadriceps strengthening exercises and hamstring spasm relaxation techniques. And if you look into the other features of knee osteoarthritis can produce significant depression because of chronic pain, cyclothymia, dysthymia, etc. And during rainy season, most important thing is to use a walking stick. Suppose the patient is having right knee osteoarthritis, they should hold a stick in the left hand. So this will help the patient to maintain normal walking cycle where the hand and the legs are moving together, and the length of the stick should be such a way that the head should in alignment with the crease of the wrist. And when the patient starts moving, first the right leg is dragged forwards, and when the foot touches the ground, the patient should bear the weight on the left sided stick, that is the stick which is held on the left hand. Subsequently, the patient should drag the left leg. This is how we should ambulate during rainy season when they use stick. And patient can use simple quadriceps strengthening exercises, that is straight leg raising exercises in their couch. And if there is any problem, they can use painkiller gels if there is any pain. And in case if there is muscle spasm, they can use topical application of thiocalcificide. And if there is severe spasms, they can use centrally acting muscle relaxants like tolpyritazone. And when they enter the severe rainy season, they should try and avoid slippery places. All the slippery places should be covered with the mattresses. And if they have cataract, they should undergo cataract surgery before the rainy season. And if they have something like benign paroxysmal positional vertigo, the patient has to consult a ENT consultant and should be treating it. This will help to maintain the balance. And patient should continue the drugs prescribed by the rheumatologist previously, that is glucosamine with diacerin or glucosamine with the type 1 or type 2 collagen. All these things should be continued. And the patient can get out with lots of care, and they can use even a walker if there is osteoarthritis of the both knees. And they can perform their regular activities, but they should not sit down or use Indian toilet. They should use European toilet, not climb down or climb downstairs. And they should not do namaz sitting down. They should do namaz sitting on the chair. And they should not do Sashtanga Namaskar to the God. They can just say Namaste to the God. So lifestyle modification during monsoon will help. And if it is coupled with osteoporosis, then the risk of fall and fracture becomes more. In my next video, I will speak about osteoporosis and how to survive osteoporosis. Thank you. Do follow me.